Welcome to the Cortisol Coach Podcast. If you're exhausted, gaining weight, losing your hair, your anxiety is through the roof, or the depression and emotional overwhelm have completely consumed your life, or maybe you're not showing up as the wife and mom you want to be. You've spent years never feeling good enough, taking care of everyone else while you quietly fell apart. And your body has been keeping score of every single bit of it. The chronic stress, hormonal shifts, perimenopause, menopause, whatever season you're in, cortisol is making all of it worse. And until you heal the root, nothing changes. But this show here is about to change that. I'm your host, Christine Marie, Holy Spirit-led biblical mindset coach, and I have helped thousands of women heal their hormones and cortisol levels. Every week, I bring you leading experts, doctors, and coaches who will help you heal your body, mind, emotions, and your spirit so that you can step into every kingdom purpose that God has planned for your life. So go grab your cup of coffee and let's jump in. My guests today are the founders of Eviva, a practice built for the woman who always knew there had to be more. Dr. Abigail Hart and Dr. Charise Fashho are both double board certified physicians in obstetrics and gynecology and obesity medicine. And Dr. Fashho holds additional certifications as a Menopause Society Certified Practitioner. Together, they bring decades of clinical excellence spanning gynecological surgery, metabolic medicine, hormone therapy, and longevity-focused care. But what makes these two women extraordinary is not just their credentials, it's their stories. Dr. Hart was a chief resident, a gynecologic oncology surgeon, a lifelong athlete, and then came her own breast cancer diagnosis. That experience cracked open an entirely new understanding of chronic stress, inflammation, and what it actually takes for a woman's body to heal and thrive. Dr. Fashho built her career across some of the most demanding clinical environments in this country, from Tulane Medical School to Ochsner Medical Center to the University of Pittsburgh. And it was motherhood and witnessing burnout firsthand that shifted everything. She stopped treating symptoms and started asking that question of why. Together, they founded Eviva Total Wellness with one single mission: to serve the woman who has been told she's fine, handed a prescription, and sent home. The woman who knows in her bones that something is off. The woman who always knew there had to be more. Dr. Hart and Dr. Fashho, welcome to the Cortisol Coach Podcast.
Thank you so much for having us. And that introduction was like 5 out of 5.
Yes, thank you.
You made me smile from ear to ear. I was just like, oh my gosh, I'm so over the moon right now to be here on this podcast with you.
I knew once you and I, the three of us, had that first conversation, I knew that my audience had to hear from you because just like you both, I spent years and years and years looking for a solution, handed prescriptions, but never being asked the right questions or truly looking at why or what could be causing this. So what led you here?
Honestly, truly deep in my heart, I think what led me down this path was my diagnosis in 2023. And I had so many questions. Why did this happen? I work out, I'm fit, I drink water, I don't drink alcohol, I don't smoke. I had so many why questions. And I think just as I progressed, I realized just the traditional medicine route did not teach us about root cause, more holistic care, more about cellular metabolic medicine. And I realized no matter how much I worked out, I went paleo, I cut out gluten, I did so many different things. I didn't feel any better and I still had no answers. And that's what started me, I think, exploring other facets of information, not just the traditional route, and branching out and seeing, well, what else works? Because traditional medicine isn't helping. Just by looking into all these different outlets, whether it was research papers or anecdotal evidence or going on forums and listening to other women and men with their complaints and their lifestyles and how nothing's getting addressed, I realized like this is such a common problem. And I'm one where if there's a problem, I'd like to figure it out. I'm a puzzle solver. So it's really exciting that I'm able to finally do this and dedicate my life to this. And we're always learning, and the field of medicine is always changing. Yesterday, I was looking at research papers from this year that just came out. That was very exciting. So it's it's really it's a privilege.
Yes. And, Dr. Hart and I, just taking it further back, like we met on the labor wards, both working as, pretty intense jobs as OB hospitalists. And that's where we connected. We really found, I think, a beautiful friendship in the fact that we both we try to take away our stress by living lives outside of work as mothers, trying to find ways to connect through our friendship. We started doing exercise together. We found different types of exercise, whether that be a bar class. We were getting into the megaformer type classes with Tremble, a local kind of chain that we really found joy in, like doing things together outside of work and just kind of learning from each other. I think it was really a beautiful thing. And so the idea of like giving something more to the community or to ourselves and to our families is really where this all kind of came together. And then just a plug for our logo, if you look at it, the bird of paradise, we knew that that was the flower we wanted to represent what we're bringing to our patients. It's a tropical plant and it really does thrive in harsh environments and hurricane storms and soil that's not necessarily the most fulfilling. Just like our work when we were working, night shifts, 24-hour shifts at the hospital, really found ourselves kind of struggling with how can we sustain doing this forever for ourselves, for our family? Is it affecting our health? But then the bigger picture is I think we can teach ourselves things and we can teach our patients more things.
Say it was like a synergy of coming together because I feel like even then, like we were still at that point in the throes of traditional medicine, but then we're like, hey, I have this crazy idea. Let's, what if we tried this holistic thing? Or we started doing red light. Dr. Fashho was already doing sauna. She introduced me to sauna because I'd never done that before, but it does have so many benefits. Whenever we had these ideas to explore these different outlets and branch out and do a little bit more root cause, like we never told each other, hey, that idea is too crazy, it's too far fetched. Like we just supported each other along the way. And we feel like both of our health journeys, the ultimate, I think one of the purposes of our lives is to give back, to live wholly and purposefully. And why not share the fruits of our research and the things that we have found, even by treating ourselves with these methods that we were not taught. We had to be the experiment the last few years. We understand life is stressful. Sleep, our environment, it's not as clean as what it used to be. Lifestyles are not what they used to be. So our bodies are constantly on the defense. So how can we prime our bodies, not even just from nutrition and exercise and activity, but even on the cellular level? And that's where our interest lies, like to prime people for just everyday life, make them feel better, make them feel heard.
There are so many women, just like myself included, that went to the doctors as we're walking through perimenopause. I'm now in menopause, but I asked for labs, I asked for tests, and the results would come back and they would be fine, but I didn't feel fine. So can you talk more about that piece? Why would a woman's labs come back normal versus what is it that you guys do differently?
So that's interesting. I was reading about lab values the other day. When some of these labs figured out their lab values, they weren't tested on women, number one. Some of them have, but also what one person's level is and they feel right, it's not going to be consistent with the other person. And then it's more complicated than that. How much is actually getting into the cell if everything looks normal? Like, is that even getting into the cell, to cause an effect to make you feel better? There's more layers to just a lab, which is why we don't treat levels. We get it. It's important to track. Our patients love to see data, but it's not going to be the end all be all at all.
And just to kind of reiterate what Dr. Hart is saying, most normal lab values are based on a statistical bell curve, right? You have a median and, the 95%, 5% confidence interval. And like not everyone falls into that. How you're feeling doesn't always correlate to lab values. And I think in our hard work in the hospital, we kind of realized that, maybe it is a little bit of the hospital's goal to keep patients sick and like some of the things we're like hearing and the meetings we would go to. And so I feel like when we realize like maybe there is something more to the non-traditional medicine, right? We're both allopathically trained physicians, which are why we have the letters MD after our name. There's also an osteopathic school of thought, which is also very similar. They do a little bit more naturopathic techniques and like adjustment techniques that they learn in their medical training. But as far as the traditional allopathic training, we were both realizing that, they're not teaching us everything. We're just kind of following what those before us did. And we're learning how to, just this standard of care, which has been great for most people. But I don't know, is the end goal really just to keep people sick and in the hospital? Because that's not what we want to do. That's not what we want for our children. And so we kind of looked more into the functional side of medicine, which a lot of, big cities, we're not really in a big city, we're in a large town. And so a lot of big cities have functional medicine specialists, and there really aren't any around us, maybe some physicians that are getting into it. And so kind of learning and educating ourselves with our own research, with going to conferences, just leaving our comfort zone in order to acquire more knowledge. I think that's something that is lifelong for both of us and is why we kind of looked into the non-traditional type of workup, testing, or root cause analysis, which is really not how most physicians, if you're seeing a standard trained physician in hospital or center in our country, are trained.
Right. So talk to us a little bit more about what does a holistic approach to women's healthcare look like in your practice?
So when I say the word holistic, I mean whole, tip to tail. I want to know about lifestyle. I want to know about like any major life events, sleep habits, cravings, what type of foods do they like? Obviously going through a medication list, which may or may not be fairly extensive, and any and all supplements as well. Because the body is really good at telling us when something's wrong. Like our hormones are off. Okay, well, why are they off? Because it was just kind of like, okay, we're giving everybody estrogen, progesterone, testosterone. That's the end result of something else, though. So we need to treat up the tree. Like we need to treat why are those hormones off? And you have to do a deep dive. And what our patients need to understand, and really your listeners in general, when we're trying to fix cellular health, metabolic health to fix the hormones, it is never going to be an overnight thing. It's not going to take just 24 hours. There's no magic pill. Because it's a deep dive with lifestyle and other medications and, do you have anxiety? It's so many things that we address, and it takes many months. But if you've been feeling bad for 6 or 7 years, and when I say bad, just like not yourself, your energy's low, you can't sleep, you're wired but tired, etc., then if we work on you for a year and you feel that much better, you have all these years ahead of you to feel better and feel like yourself and feel like you want to feel. So it's worth the time investment.
Yes. And, to reiterate, Dr. Hart, holistic women's healthcare means understanding that the body does not operate just on one isolated compartment, right? As an OBGYN, it's like we were only trained to pay attention to the ovaries. But really, the hormones affect sleep affects your metabolism, stress affects inflammation affects everything. And so a holistic approach asks not only what symptom are we treating, but it also asks what is the body trying to communicate. And so that's what we're trying to help our patients understand. How are these, communication pathways in your body, how are they off? And it's not going to take just one thing. It's not going to be just a little prescription on a pad like what you're used to getting. It's going to be, hey, how can we work through some of your psychological trauma or stress? How can we optimize your physical well-being with physical therapy, with exercise? There are foundations, but also other specialties in our community that can help you just as much as your physician.
One other thing that you both specialize in is obesity medicine. And I would love for you to talk about obesity medicine. How does that even fit into the hormone conversation?
Obesity medicine has anything and everything to do with hormone balance. Your adipocytes, which are your fat cells, are hormonally active. Inflammation is basically going to dictate anything else downstream. If I prescribe you estrogen and send you out the door without addressing anything else, you're still going to have that degree of inflammation. And there's inflammation all over the body, even in the brain. So then I'm not treating you to the fullest extent. And in fact, if I could treat your inflammation, I might actually treat your hormones without you having to be on hormones.
And just from having taken the obesity medicine specialization exam and the NAM certification. I mean, the obesity medicine exam was so hard. That was probably harder than our OBGYN boards. Obesity medicine is not just about weight loss. It's understanding the complex physiology that surrounds metabolism, appetite, inflammation, hormones, insulin resistance, like muscle mass. We learned a lot about that on the exam, sleep, and longevity. So it really was kind of our first steps to getting into this. Like, we wanted to help our patients. We're located in Louisiana. It's one of the most obese states statistically in the country. And so our patient population, even in the hospital pregnancy wise, we have our obesity is kind of the norm, the average here. And so we knew we wanted to help our community in a root cause way. And I think getting involved in learning the obesity medicine applications to optimize our knowledge, I think was essential. The body just is so complex, and it's not just, one thing, seeing a doctor that specializes in the kidney or the brain. It's like you need a doctor to really synthesize everything.
And can put it all together without you having to go to 4 or 5 different offices. Yes, like she said, it's almost crucial for someone to be able to have this depth of understanding.
And even counseling patients, I say, the GLP-1 medications, they didn't come out as weight loss drugs initially. These were type 2 diabetes treatments that were aimed to, fix insulin resistance, help with diabetes management. And then now we are applying them to not only weight loss, but even greater things now, opioid addiction, alcoholism. There are so hormones and menopause. I mean, there are so many anti-inflammatory pathways that we're finding with just the GLP-1 receptor, and there are more and more coming out. And so I think we're really onto something, and I think we just love learning.
I feel like a lot of women over 40, the first thing that we notice is the weight gain as we step into perimenopause or menopause. But if you truly sit there and think about, well, how do my knees feel? How do my ankles feel? How does my brain feel? How is my memory? There's so many other pieces.
Yeah.
But I think because we're looking at ourselves in the mirror, that's the first thing we notice. And so I love your full body approach. And gosh, I wish I had it so many years ago.
We do too. I wish we would have done this years ago.
Yeah, somebody would have told me about
We didn't meet each other. It's funny, just another little side story that I always
Yeah.
find so
Yeah.
interesting is that Dr. Hart and I, we probably were supposed to do residency together. You have this rank list when you're in medical school to match to a program. And I think had we met then, would we have started this early? I don't know. We can't but here we are. We met in our late 30s, early 40s, and we're doing this now.
Yes.
So
Good
let me
things come in time.
100%. Well, and let me ask you a question. What are some of the most common symptoms that women are dismissing that are actually pretty serious hormonal signs?
I feel like in the media, number one, you would say hot flashes, but I think really it's feeling down. Like, people forget because it'll just kind of be this lingering, almost like apathy, and then it forms, becomes depression, and then that interferes with the sleep cycle. I think women don't realize how bad they feel because of how busy they are, but when they actually take the time to sit down, they're like, "Oh my gosh, I don't feel like myself." It can be corrected, as long as we're addressing the symptoms. And
maybe many of us, a lot of us these days have delayed our childbearing years to around this age. And so it's like the sleep disruption, your kids aren't really sleeping well, at least my daughter isn't. And so it's like, oh yeah, getting up at this time of night, you don't notice it maybe. Also the increased anxiety, I think that's an overlooked symptom. People feeling on edge. I think Oprah talked about she didn't realize her heart palpitations was actually this transition and not something more. And so, they say women are just, we're always taking care of others, and we just really sometimes need to listen to our own bodies in order to take care of the others. But, we just kind of dismiss things often just because we're trying to make our children's doctor's appointments and not our own.
Yeah, and that's the other thing. We're a big proponent of self-care. You've got to take care of yourself in order to take care of others. And it's so easy to get caught up in the day. Your entire schedule's blocked off and day to day to day. And then, you're feeling bad for years and you don't realize it because you haven't made the time. When we can address all these things, and we can try me. I'm not saying you're going to be 100%, but we're going to get you to a better place. We meet patients where they are, of course, and we discuss goals. It's just those lingering little symptoms that may or may not actually be a big deal.
How does somebody work with both of you? because this sounds like a dream, but do they need to be local to you? How do you offer patient services?
So currently, we have an office that will be opening very, very soon. We redid the interior of the office to our specifications. So we're very excited about that. We think the patient experience, it's going to be unlike anything else.
So we'll probably open our schedules. Currently, we have a few state licensures. We're probably going to just see patients in Louisiana to start locally in our town of Lafayette, Louisiana. But we likely will set up telemedicine in the near or semi-near future. So that potentially could be something to reach a larger audience. We're just kind of getting started. It's such a beautiful thing. And so, yeah, we've been kind of like slowed down by construction, but I think there is beauty in slowing down. And I just have to say, we do love your podcast. I mean, cortisol isn't an enemy, right? It's a survival hormone. Like, it's helped us stay alive for so many years. But in our modern life, we're just living in a constant state of go. Our sleep is poor. The two of us are still doing the shift work until we transition this practice over. These blood sugar swings, inflammation, we're under eating, we're stressed, we're going through a change that is essentially natural, but we have constant stimulation. The body could only adapt so much. And so I really love what you're doing and putting out there, but we'd love to reach a larger audience. I think there are other practitioners out there who are listening to us and that they might be thinking the same thing. And so OBGYNs out there, like, you can do it. Like, it's not all about just grinding away, seeing 50 patients a day. I mean, I do believe our field is underserved. There are more women joining OBGYN medical specialty, but I think working night shift does serve a time and a place. Like, it can't be forever. I don't think our health is worth just that kind of sacrifice. And I think our patients would understand too. They want healthy doctors. I would want my doctor to live forever.
And I did want to add to what I think is unique about our practice is, this is Dr. Hart speaking, Dr. Fashho and I, we discuss every patient. The practice patients, they're both of our patients. So if one is out or, if there's a time slot for one or the other, you're a member of our practice, of our lifestyle, of our Eviva, our brand, our vibe. We don't want anyone to feel like, oh my gosh, like, this doesn't work with my schedule. No, that's what we think is very unique about the practice. So we can work with your schedules, and it's like having a team of physicians treating your case. And if we have to do trial and error, because remember, everybody responds differently to different methods. Like, we're all different.
Right.
And I think that's what the beauty of it is. And then, we have our close connections with, physical therapy, some movement teachers, different things. So we all know who our referral spaces are. We have their phone numbers. We text each other. So it's a very close knit sort of clinic where we know everything that's going on, and we're offering services that, if we were the patient, this is the exact experience that we would want.
Yes, it's like we're calling it a health club, a vibe. And so, yes, Dr. Hart and I are both interchangeable. We both are treating each patient together. And I think, a slot open on the schedule would mean just book with either of us. If you go to the availability of your schedule, because we are treating you the same, and we're very excited.
This is so amazing. Let's give the listeners a first step. So let's talk to a woman who is exhausted. She's been dismissed. She's ready to do something different. What is one thing that she could do today that would help impact where she's at?
I think the first step, and looking back at Dr. Hart and Dr. Fashho, that's me, our journey, I think the first step is take a look at your tribe, at your network. And, I think that the stress and the overwhelm that we were having at work allowed us to connect. And so I think starting with a friend, a resource, see if anyone around you, maybe a coworker, is going through the same thing, and see what resources they have tried. If you've tried the internet search, functional medicine is a good word to search for. You can look at the NAMS, which is the North American Menopause Society's website, to look for certified practitioners. But I will give you the caveat that not all of them think this way. I mean, a lot of the training, the allopathic training, again, is very much prescription based. And so I do think those that are maybe studying this or certified in it might be more willing to listen to your complaints and offer some treatment. But if you're still cycling through a treatment, I mean, for example, myself, 41. I'll be 42 in a few months. Sorry, I'm jumping ahead, but I'm 41 now. And I just last year was really experiencing brain fog, hip pain, discomfort in my hips. Of course, sleep has always been an issue, but I attribute that to my job, of course, working nights and shift work, delivering
Right.
babies in the hospital. And so, yeah, I kind of ignored that one maybe, but just like recognizing that something feels off. The brain fog is a little bit more, I'm a little bit more forgetful. So, of course, I talked to my GYN. We started estrogen patch. I already take progesterone, contraception, IUD form. And so we started it. And for 6 months, nothing had changed. And I'm like, this isn't great. I had the negative, right? If you have too much or too little, I was
Right.
having breast pain now because I had too much estrogen. And like,
Right.
why? Like, it's not fixing this. So that's not really the answer. So let me just do a deeper dive. And of course, Dr. Hart and I were going to conferences for longevity medicine, for, more learning more this like deep dive into the functional medicine space. And so we were like, let's do some saliva testing. And so, I mean, that's another good keyword search. Who offers saliva testing near you? So
Great
we
tip.
understand that the saliva is where is a better representation of our tissues than the bloodstream, right? If the hormones are in your blood, it's not really doing anything. We need a
Right.
representation of what the hormones in the tissue are doing. And so we did some of that. We met with one of our local longevity medicine specialists, Dr. Chu, shout out, and she kind of did some of this genetic testing, and we did metabolite urinary excretion testing called the Dutch test, which is pretty informational. I was able to figure out, like, am I clearing out my estrogen well? And so synthesizing all of this information and getting ourselves tested, I figured out my problem is actually, it's a buzzword, but estrogen dominance is the only way to explain what was going on. I actually have too much estrogen in your progesterone goes first. And so,
Right.
yeah, as an OBGYN, I can honestly say I knew that, but I didn't recognize it, right? You're not like, oh, yeah, your progesterone's gone, because I think we were just truly trained to just, this is a fact of life and you can live with
Right.
it. Or, but truly starting an oral progesterone bioidentical would not only help my sleep issue, it probably would give me what I'm losing. It would bring that ratio of estrogen to progesterone back to where it needs to be. And so, yeah, I also did more testing and realized I don't metabolize vitamins well. I have the MTHFR mutation. I mean, all of these things are probably not making sense to the average user, but what we're saying is that it was more than just what I was essentially normally trained to recognize in my own patients as an OBGYN. And I think there's so much to learn. I think right now is a critical moment in women's history that we are the experiment. I think we are figuring things out for ourselves because we not only want to, we want to better our children, our neighbors, ourselves. And I think now that I've kind of figured things out for myself, that's what's motivating me to figure things out better for the patient. That's what I did my whole life. I feel like even I have a certification in the international breastfeeding lactation consultant. I did that when I was struggling. Like, I really struggled with breastfeeding with my son, and I just didn't want that to happen for my daughter. So yeah, I got certified, and that was a hard exam as well. And I think I just
Right.
always want to learn the best and the most factual knowledge. And I just don't think that traditional medicine or modern American medicine is training us the best for women's health.
I love that you brought up all these different tests because I'm saying, yes, yes, I've done that. I've done that. But I had to go to so many different doctors and specialists for them to run these different tests. And so I love that you're bringing up all these things. For example, I'll just throw this out there. I was diagnosed with social anxiety disorder in 2007, but it wasn't until I had my genetic testing done that I found out that I have two serotonin mutations and the double MTHFR variant as well. So it wasn't necessarily that I had social anxiety disorder, it's that I have a serotonin deficiency. And so
Wow.
it's truly the more you know, the more testing you can get done, the better, because then you can even figure out, I know I'm a rapid metabolizer. There's all these different pieces of information you can gather with more testing.
Mhm.
So I love that you
Yes.
brought all of those pieces up.
Yes, this is where modern technology is helping us. But I think I don't know why traditional physicians are not understanding this, I think it has a lot to do, I think, with insurance, and just not to go off the total rocker, but they're not going to cover it, right? You're going to have to pay out of pocket for these tests. At the end of the day, it's probably worth it to find out some information that you can actually get helped with.
If you strip everything away, all you have is your health left. And I've also been trending out wellness trends and just seeing the transitions over the last few years. And, they say health is the new handbag, but I'm totally all here for it. When you're healthy, your skin quality's better, your hair's thicker, your body just gets happy. And then you have that beauty that kind of, it shines out from within.
I am just so thankful that both of you were on the podcast today. I cannot wait for our audience to connect with both of you. Where can they find you on social media?
So it's at Eviva.md. So
EVIVA.md.
And we have a link tree, and our website is just about finished. We put a lot of heart and soul into it. And again, good things take time. So we're not rushing this out. We're making sure everything is to our standards and everything we want it to be. We want to be proud of what our name is on. So I would say get on our Instagram and keep watching.
And your Instagram is so fun. You guys have so much personality. I love it. A huge thank you to both of you for being on today's episode. And you can find all of the information in the show notes so that you can connect with both of them. And I will see you guys next time.
Thank you.
Thank you.
Friend, I am so thankful that you were here today. I pray this episode blessed you big time. And if it did, would you do me a favor and leave me a review on Apple Podcasts? It helps more women just like you find the show, and it may be the very reason that somebody else gets the answers that they need. I would also love to connect with you personally on Instagram. You can find me by searching Cortisol_Coach. That's where I show up every single day. And send me a DM. I would love to connect with you. I'll see you next time.